Welcome back, everyone. Tennessee's struggle with prescription drug abuse continues to be a growing problem. Just this month, a study in the Journal of the American Medical Association said that between 2007 and 2011, a third of the people in our state filled a prescription for a narcotic painkiller. A local doctor reached out to us wanting to shed some light on the other side of this epidemic, the people writing those prescriptions. Tonight in a special report, Sixers anchor Lori Tucker is on your side as we sit down with that doctor, as well as a pharmacist and a recovering addict, to learn how to break that cycle of dependence.
I feel terrible as a doctor when I see this, even if it wasn't my patient.
Dr. John Kupfner works at Peninsula Outpatient Center here in Knoxville, where he comes face to face with addiction every day.
Doctors have a lot of pressure from patients to give them immediate relief.
But often those addictions didn't start on the street. Now he's seeing more people who've grown dependent on narcotics like hydrocodone after getting legitimate prescription from their physician.
The problem is, once your body's adapted to these medicines, they don't really work anymore. They don't work like they used to. You start just taking them to feel normal again. You take them so that you don't have that withdrawal, so that you feel just like you did before we ever gave them to you.
Because doctor and pharmacy shopping has become so common, physicians are trained to spot drug-seeking behaviors. The red flags include asking for more frequent or higher doses, filling prescriptions early, reporting medications as lost or stolen, and going out of state for drugs. You might not know it, but a special database keeps track of every controlled substance you bring home from the pharmacy, and your doctor is required to check and make sure you aren't getting multiple medicines from different sources.
I got popped on one of those lists back in 2002.
Steve Wildsmith is a former drug user who's been clean for 12 years. Today he's a consultant with Cornerstone of Recovery, but shortly after getting a prescription for hydrocodone following surgery in 1994, he got hooked.
I remember the first time I took it, I didn't like it. It made me sleepy, and I just went to bed. But the next day, I had to go to work. My knee was hurting. I took it, and all of a sudden, I felt fantastic. Whatever switch it was got flipped on.
And that switch stayed on until 1999, when Steve found himself swallowing 20 to 30 pills a day.
I moved on to cocaine, to Oxycontin, to heroin. By that point, I was ready to admit that I had a problem, that I was an addict.
He went through rehab twice.
Everything hurts. I remember when I was withdrawn from heroin and from Oxycontin, my hair hurt. Everything hurt. You can't keep anything down. Your guts are a wreck. Sweating, uncontrollable leg spasms.
When you're coming off of opiates, you wish you would die.
Cheryl Zoborowski is the head of at Peninsula. After being on the front lines of the drug abuse crisis for more than 20 years, she says it's still heartbreaking to see the toll these medications can take.
What I say to the patient is, do you want to numb that pain or do you want to cure it? Because I've got something better for you that's going to fix your pain, so you don't stay on this vicious cycle of chasing after your pain management.
What do they say?
They don't believe me, because their pain is so intense. They don't know that there's a better way.
Other treatment options depend on a patient's situation, but they can include therapy for anxiety and non-habit-forming drugs like high-dose ibuprofen for pain.
If we aren't careful, we make people addicted, and when you make people addicted, you make them prescribed a whole new set of behaviors and problems in life that they may not have had we had the courage to not put pen to paper for too long a period of time.
So a patient comes in, they have back problems, they want pain medication. What do they need to ask you?
You need to ask the question, like, am I going to become addicted to this medication? What happens if I do? What am I going to look out for? What do I need to do to protect this medication? Because the whole other side of this, as a child and adolescent psychiatrist, I mean, these drugs hit the street.
If this huge problem of addiction keeps going and going and going, what is this doing to our society?
We're making future generations of addicts.
Anybody who is struggling with addiction, there are places like, Cornerstone of Recovery, like Helen Ross McNabb. They're right here in East Tennessee that will help you. You don't have to live like that.
Now, Lori put some contact numbers for you on our website at WATE.com, and we should note the Drug Enforcement Agency has taken a hard look at prescription drug abuse across the country, and they are taking action. This year, the DEA will upgrade hydrocodone combination products from Schedule 3 to Schedule 2 drugs. That means further restricting